Hi, my name is Shriya Jain, and my project evaluated pediatric dental residents' perspectives on the use of psychology-based behavioral techniques when treating individuals with special healthcare needs. People with special healthcare needs are among the most underserved groups in dental access and utilization, largely due to an inability to locate dentists comfortable treating this population. There's a gap in formal education in regards to working with people with special healthcare needs due to their sensory sensitivities and communication challenges. Our goal was to identify where these gaps of knowledge were and to evaluate the effectiveness of a 2-hour interactive lecture. This lecture was on sensory processing disorder management and behavior psychology techniques used by occupational therapists and educators who work with this population. These techniques have been shown to improve coping skills and adjustment to new situations. Last year, all 10 first and second year pediatric dental residents were in attendance for this lecture, and this summer we repeated this lecture to the 5 new first year residents. All 15 individuals were asked to complete pre- and post-lecture surveys. The pre-lecture survey was to establish their baseline knowledge and comfort level with treating specific populations and using various techniques, as well as to see if they had any previous exposure to the lecture topics. The post-survey evaluated knowledge and comfort level after the lecture and asked about the residents' perspectives on expanding education in this field. Figure 2 demonstrates the results of fact-based questions before and after the educational session. As you can see, the green indicates the correct answer. The majority of respondents answered incorrectly or were unsure prior to the lecture, as indicated by red and yellow, but upwards of 90% answered correctly after the lecture. Figure 3 demonstrates how residents were especially interested in hands-on opportunities to apply the techniques presented in this lecture. We had asked the residents about their prior exposure to the lecture contents, and they had mostly learned about these topics through articles and lectures, but they seemed eager to practice implementing these skills. In Figure 4, you can see the overall positive shift in residents' comfort levels based on a 5-point Likert scale. Our analysis was more qualitative than quantitative due to a small sample size, but we are interested in expanding this lecture and surveys to more residents and to continue pushing education in this field. By expanding training that strengthens providers' skills and comfort treating people with special healthcare needs, we can improve accessibility to oral health care for this population. Thank you so much for listening.